Gum disease may be fatal to your unborn child. Most women already know that having a baby puts a considerable amount of strain on a mother's well-being. Most medical studies focus on her hormone fluctuations and other aches and pains that come with such an enormous change to a woman's physiology. But these researchers are overlooking something vital. It's a fact that nearly 70% of pregnant women develop inflammation of their gums or gingivitis. This condition is so common that it's been labeled pregnancy gingivitis. But that condition has a very dark side. This is because, if left untreated, gingivitis often progresses into periodontal disease, a serious condition that leads to oral lesions, jawbone deterioration, and tooth loss. Unfortunately, prenatal care often fails to address this important issue, and as a result, this dangerous condition goes undetected. We must address this situation by insisting that prenatal care facilities institute a check to ensure the patient doesn't have periodontal disease, as well as checking for the usual warning signs that the baby's well-being may be in danger. Nearly 7 million newborns die every year due to prematurity and low birth weight. In the United States, it's around 7%, with the United Kingdom and Europe having a similar amount. In Africa, however, the percent of newborn deaths is staggering. It's double that of the US and Europe. In South Africa, newborn deaths account for nearly 40% of all deaths of children under the age of 5. In less advanced countries like Angola and the African Republic, 1 in 10 dies within the first 4 weeks. Why? There are, of course, many factors to be considered, like the age of the mother, smoking, high blood pressure, etc. But studies done in South Africa and Rwanda clearly show a strong likelihood that women who have had periodontal disease would give birth to children prematurely and have a low birth weight. Why does periodontal disease have such a profound effect on pregnancy? Studies show that women with periodontal disease possessed an imbalance of the protein cytokines. This imbalance could create inflammation inside the woman's body, triggering a preterm labor inducement. It seems that every few weeks, modern science is discovering additional proof that much of the body's physical problems can be traced to poor oral hygiene. It's simple to see why. Bacteria causes inflammation, and inflammation leads to internal physical ailments. A healthy, disease-free mouth, however, can kill virtually any bacteria that enters, thereby preventing such instances as premature birth and low birth weights. So, to ensure your baby's health, visit your dentist and brush at least twice a day. Use an oral irrigator such as the Oral Breeze to remove trapped food particles, and rinse with a fluoride mouthwash to make sure the bacteria is eliminated and their breeding grounds are blasted away by the Oral Breeze dental irrigator.